Hello, everybody. Welcome to another episode of Find Your Model Health, the official podcast for those looking to optimize their long-term health and weight goals and understand how their body really works. I'm your host. I'm Shmaine Linney. I am a nutritional therapist, integrative health practitioner, and certified iridologist. I'm very happy to have you back with me for another piece of your day. We have a very interesting conversation for you today. But as always, before we go on, I must remind you that the information in these podcast episodes is for informational purposes only and should not be taken as medical advice. Please consult your health practitioner before making any lifestyle changes. So today, please help me welcome the lovely Christina Thomas, who is president and co-founder of Myself Wellness and co-founder of Warriors of Consciousness. So I understand because a lot of you are in Canada, you may not have heard of Christina. So she's going to give us a little bit of introduction on her background, how she got into the area of mental health and consciousness, and basically what you do, Christina, if you don't mind.
Yeah, thank you so much for having me. It's great to be on your show today.
Thank you for coming.
So I am Christina Thomas, like she said, the co-founder and president of Myself Wellness. Myself Wellness is a psychedelic ketamine clinic based in Bonita Springs, Florida. And Warriors of Consciousness is our nonprofit because we believe everybody should have access to these type of therapies.
Yeah, which especially, well, depending on where you are in Canada, many people cannot get access, but a lot of Canadians, as I'm sure you know, have a second home in Florida, all our snowbirds. So what got you into this? Like, why? It's such a different field. It's not that norm when it comes to mental health. Like, what got you into this?
No, I know it's not the norm, but we're doing absolutely amazing things here. So I was on my own spiritual path in 2019, and that is when I met my partner and fiance, Charles Patty. And Charles suffered for over 20 years with substance abuse issues and self-medicated with drugs and alcohol to numb that pain. And it was through the use of psychedelics that he was able to alleviate all of that out of his life. And we had our son, and he was about 6 months old, and he asked me to go on this leap of faith with him. And we started this wellness center where we eventually wanted to do ketamine treatments one day because, like I said, psychedelics profoundly shifted his life. And one thing led to another, and then we opened our clinic, and we opened our clinic 1 week before the COVID lockdown.
Bad timing or good,
Bad timing,
depending.
but it really gave us the time to perfect what we're doing here and specializing in psychedelic ketamine therapy. There's a lot of ketamine clinics out there, but they don't do what we do. We really get people into the profound psychedelic states where a lot of other places just kind of scratch the surface on that. And I got really passionate because I was watching these deep transformations in people. People would have no life left in them, no color left to them. And through the set of treatments, they would begin to transform. Their energy totally shift. They would start smiling again. People, their family members were telling us that they are the person that they knew 10, 20 years ago before they started getting really depressed and anxious. And it's just really empowering to see how people are transforming.
What kind of people were you seeing come to the clinic? Like, did they primarily have a lot of mental health struggles, which, like I kind of mentioned a minute ago, is kind of divine intervention that this happened just before the lockdowns, because on the other side of the lockdown, we have an enormous amount of mental health issues due to the lockdown. So again, kind of got lucky there.
Yeah, but even before that, people have been struggling. And I feel like the lockdown from COVID really excited that more people have depression and anxiety now because their lives were just thrown into a tailspin. They were stuck at home. And and things are just, they're different now.
Mm.
But we see all different kinds of people with substance abuse, anxiety, depression, PTSD. We see a lot of childhood trauma. Um, and what I'm really passionate about is just there's so many people, women, men, everybody there. We see so many people with different sexual trauma, and it's having a small child. It's terrifying, and it's very, very sad to see this epidemic that we're seeing right now.
Why do you think, apart from the pandemic, why do you think it's so bad? Do you think there's other factors playing a part, like people have lost hope or they're finding life is just too difficult now?
I mean, I think that social media has a lot to do with it. Everybody wants this life, this big life
Mm,
that they see online, but that life is usually it's a big lie.
yeah.
Everybody can look really happy and really skinny and really beautiful because that's what all the filters do.
Hmm.
But once you take that filter away, it's just a shell of a person that they don't know what their purpose is. And they see this big flashy life and it's unobtainable because it's fake.
They're
I
equally
think
unhappy.
they are. I think a lot of people are depressed because they don't really know what their true purpose is, and trying to navigate these waters, it it can be confusing and scary and hard to do.
I'm very glad that you mentioned purpose there. This is a topic, I don't know if you know who Tom Bilyeu is, and even Dr. Mercola, I'm sure you've heard of him. They speak a lot about purpose being the path to happiness. And when people don't have a purpose, and then when they're not actually making progress
Yeah.
towards that purpose, then we have a mess. We have everybody unhappy, lacking joy, lacking motivation, and of course, then the mental health issues eventually ensue. And I would argue for the majority of people.
Yeah, I agree. We don't just rely on the medicine at My Self Wellness. We teach people about making healthy lifestyle changes, about meditation, about going to the gym, breath work, which is all the recipe for long-term success with the medicine. Because if nothing changes, nothing changes. If you are an alcoholic and you continue to keep going to the bar or popping open a bottle of wine at night, you're not going to get any better. The
Yeah.
medicine will meet you where you are, but you have to put in that work as well to be a different version of yourself.
Yeah. And that is, it's hard work. Even
It's
though
hard
it
work.
sounds easy, meditate, go for a walk, go to the gym. It sounds easy. It's actually way harder than people think. Like if you're in, as I'm sure you know, like in a mental hole, to just
Yeah.
go for a walk is like a huge challenge. You need a lot of self-talk. You need a lot of
Mhm.
even coercion to get out the door, even I will reward myself with something if I go for this walk. Like it's quite challenging. So with the ketamine then, ketamine, and correct me if I'm wrong, I feel like when people hear the word ketamine because of the 90s, the 80s, there's a bit of a fear factor around there. We're thinking of I'm Irish, so I'm thinking of raves, LSD,
Yeah.
all that fun stuff that we did when we were younger. But now, as more mature adults with responsibilities, where there's a fear there. Do you find that people like they're not very educated on ketamine, and even saying the word ketamine immediately we're thinking this is dangerous?
Yeah, there's a whole re-education campaign that we have to do with, a lot of the people that call in here. Ketamine is on the back of every single ambulance. Ketamine is found in every emergency room, and it's on the World Health Organization's top 5 most essential medications. So I have a small child, and if that child needed to have a surgery, they would most likely give them ketamine due to the low toxicity profile of it.
Mm,
So this is a very, very safe medication that we're giving in a very small dose. Ketamine is a dissociative anesthetic.
mhm,
And so we are giving a sub-anesthetic dose of that medication. It doesn't cause respiratory depression. And the half-life is actually 12 hours. So it's in and out of your system very, very quick.
mm. So when you're administering this to people, you're expecting them to start relaxing, almost thinking rationally, the heart rate slowing down, the central nervous
Mhm.
system slowing down.
Yes. So it just kind of drops you into this deep meditative state. We joke around and we say that you can achieve what a Buddhist monk can achieve in just an hour session at our clinic because it really just allows you to turn off your mind, and it's a full mental reset, really.
Yeah.
People are able to just let go of what has been holding them back, and they always seem to come back a little bit lighter.
I'm curious, apart from the mental health aspects of using ketamine, have you seen any other benefits in other areas of health, gastric health, skin issues, insomnia, any other areas of health? Because
All of it.
yeah.
Yeah, a lot of different comorbidities for anxieties, gastric issues. We had one lady that she would hide Tums all around her house, in her car, in her purse, anywhere she could hide them because she was always having this acid reflux. And as we started to heal her anxiety, that went away with it. We've seen several people that um, their blood pressure was elevated, but through the set of treatments, they actually got off their blood pressure medication because they were no longer as anxious as they were before.
Mm,
So it's really amazing to see all of these other ailments that happen to people that are being relieved as they're healing their depression, as they're healing their anxiety.
mm,
So everything starts to just get a little bit better.
Well,
Yeah.
I'm sure, I'm sorry to interrupt you. I'm sure you'll agree one of the main drivers of all of these different illnesses and diseases we're experiencing nowadays is a stress response. Like stress generally is at the bottom of all of it. And when we look at blood pressure, most people unfortunately don't understand that the biggest factor in blood pressure is stress and anxiety. When we think of like white coat syndrome, somebody sees someone in a doctor in a white coat and their blood pressure will go through the roof, but they go home and they're in their zone and their blood pressure drops back down again. So,
Yeah, we see so many people that do have medical trauma. And when we built our clinic, we built it on the what not to do. So it feels a lot more like a day spa
mm,
than you're going to a doctor's office to get this treatment because you really do have to be open to the treatment, and the set and setting have to be the right thing. Because if you can't relax, you're not going to get the best outcome out of your treatment.
yeah.
Every single touch point has to be properly curated for this.
At what stage did yourself and your partner come across ketamine? Like, I know you said he was having his own issues and he decided to try ketamine, but how did he come across it? Did he hear it on a podcast, a book, through the grapevine?
I mean, he had recreationally done a lot of different psychedelics,
Mm,
and he healed himself through that. And ketamine is it's not technically a psychedelic, it's a dissociative,
mhm,
but it does have hallucinogenic properties. So even though it's not classified as a psychedelic, it's a legal option that we have access to.
mm,
All these other modalities that he healed with aren't legal, so we can't legally offer things like psilocybin or MDMA right now. But like I said, ketamine is legal, and so he had, dabbled in it,
mm,
as you know about it in the club scene and things
mhm.
like that. But it wasn't until he used it for the therapeutic properties to actually heal himself that it brought him to a different level of his life. He always had a little bit of bipolar, and was able to alleviate that through the 6 ketamine treatments that he did
Is
out of
it
the clinic.
legal in all states or just Florida?
No, it's legal as in all states.
Super
It's like
interesting.
I said, it's on the FDA, on the World Health Organization's top safest, least toxic anesthetic.
Mm.
So we're using it off label.
I don't know if you're aware of a study that was done in the military in the early 1900s where they administered LSD to a lot of the soldiers. And the outcome was amazing. There's a video of it, I believe it's on YouTube, that shows all these soldiers an hour later after getting their exposure, their dosing of LSD. completely relaxed, rolling around, laughing. A few of them hallucinating. One was trying to climb the tree and get to the bird's nest. Now, these were soldiers.
Mm.
And what they saw from that, what was discovered from that specific study was that there was an immense reduction in serotonin in the gut, and that's what relaxed all of the soldiers. And obviously, they became somewhat uncontrollable. You can see some in the video where their general just kind of threw up his hands and was like,
Mm.
I can't do anything with these people. And he just walked off. They would not follow orders again because they were so relaxed. They just had almost, shall we say, elevated onto another level of not having to, dare I say, be controlled. So there's that relaxation aspect. But that was really interesting. If you've time to, might benefit your clinic, check it out.
I haven't seen that, but there's a company, I believe they're out of Australia. They're called Mind Biotherapeutics. It's a drug development company. And they just completed a phase 2 depression trial of giving microdoses of LSD.
Mm-hmm.
And in the participants that partook in the study, 60% of them, or I'm sorry, they all they improved their depression, most of them by 60%. And then 53% of the participants after the 8-week study, their depression was actually in remission.
Mm-hmm. Yeah.
So it's really, really interesting what's coming up with LSD.
There's real potential out there.
Hmm.
Is like solid potential, and I think we've known about it for a long time, but now it's only kind of getting more of a spotlight because companies like yourself are making it more known that if, hey, this psychedelic works, then maybe this psychedelic works, and so on. So I think we've known about it, but we didn't know about it, if that makes sense. Like it was.
Well, there was a whole like smear campaign that went on about psychedelics, and I think it's because, not to go down any rabbit holes, but people who don't think for themselves are more easily controlled.
Well, this is what I was alluding to with that military study. Again, the general threw up his hand. He's like, we cannot control these soldiers. They will not follow orders. Um, Maybe, just my opinion, maybe we need to suppress this information from the public
Yeah.
because, again, it's harder to control people who are more relaxed.
Yeah.
And we can go down a rabbit hole because we're allowed to have opinions. But um, right now, because of what you do, I think you'll agree we are in an epidemic of mental health issues. And regardless of what the government wants or doesn't want, people need help. And if this is a viable tool, people should be able to access it.
I agree. Um, yeah, no, a lot of people don't know this, but Bill Wilson, who is the co-founder of AA, Alcoholics Anonymous,
Mm,
he used LSD 20 years into his sobriety. Um, and he wanted to make it the 13th step, but by that time, it was
mm.
already a program of abstinence.
Uh,
And yeah, what we see just on a daily basis is it's nothing short than miraculous.
Mm. Well, I spoke about that in a video a couple of weeks ago. That even with the AA, a lot of people don't know that 80% of the people that leave AA, they end up returning to alcoholism. It's like a very small percentage, and it goes back
Hmm.
to what you said in the beginning. If nothing changes, nothing changes. These people, they weren't changing their environment.
Yeah, no, and they're not given the tools. There was a study showing that um, that Awakened Sciences had did, and they gave people who had AUD, alcohol use disorder, ketamine, and after 6 months, 86% of those participants stayed sober after having ketamine treatments.
Mm. Yeah, there is real potential. I don't know if you're aware here in Canada. Recently, well, not recently, in the last year or two, British Columbia. So I'm in Alberta. British Columbia would be the next province on the west. They legalized a lot of what we would consider in Europe, again, I'm European, to be class A drugs. Like they legalized a lot of drugs. I think a couple of psychedelics were included in there. For some people, very beneficial. For other people, it's gone a bit haywire, especially when you start to legalize heroin and stuff. Obviously,
Yeah.
that's going to be problematic, but they tend to bunch them all into the same category. So people again think, oh no, this is dangerous, and still slandering the potential in psychedelics.
Yeah, I'm all for things being decriminalized, but I also believe that psychedelics need to be done in a safe manner. And there does need to be some sort of regulations around it because that's why they got this bad rep in the beginning, is because everybody just thinks of it as a bunch of hippies going out and partying, and they're not medications. Like recently, probably in the last year, there was somebody that was on psilocybin
Mm,
in my area, and he was doing somersaults down a main road. And it's just that's how these substances are going to continue to be banned if they're
mm.
not done in a safe framework, in a legal framework where they're done not recreationally, they're actually done therapeutically.
Yeah, that doesn't seem like the best
It
idea
doesn't.
unless the road is closed. But
Oh
that,
no, a
but
very busy road.
that goes back to like the days of rave where you would see crazy stuff and people jumping off rooftops and crazy stuff. But
Yeah, but that's why there needs to be a legal framework around this rather than just decriminalizing and everybody having access to it. Because like I said before, if nothing changes, nothing changes. If we aren't shown to be responsible with these substances,
Mhm.
then we're not going to have legal access to do them therapeutically. And
Yeah.
that's sad because they are helping people.
Do you guys look at like the nutritional aspect of stuff in your clinic as well, or is it just the other practices you mentioned along with the ketamine?
We do nutritional IVs and things like that. There is a lot of research surrounding people being nutrient deficient and that being a cause of depression.
Mm,
When you take a vitamin orally, you're getting 5 to maybe 10% of the substance that's in that vitamin.
mhm.
But when you do it in an IV, you're getting 90 to 100% of the vitamin. So the best way to take your vitamins is to infuse them.
Yeah, if not with food, real food,
Yeah.
which goes back to
Well,
the
unfortunately, our soil is so depleted.
yeah, and it goes back to people doing hard things. People
Right.
eating clean and healthy. We could debate this, but it's somewhat hard for a lot of people, especially when you're looking at consistency.
Yeah.
So you also, apart from the ketamine clinic, you also run Warriors of Consciousness, and you guys have a podcast as well. Can you give us a little bit of detail there about the why do you have the second Warriors of Conscious as well? Does that specialize in something different or?
No, so we strongly believe in transforming lives and community, and that the person on the side of the road holding a sign deserves access to this therapy as well as the person who can afford the treatment. So we started the Warriors of Consciousness because ketamine therapy is not covered by insurance.
Mm,
And we don't want it to just be for the rich or the elite. So to date, we have put about 90 people through ketamine treatments. And that's just been Charles and I sponsoring people on our own. We haven't raised any money yet, but
mhm.
we just are out to help as many people as possible.
And that's what
Uh,
the Warriors of Consciousness platform really is. It's that open door or gateway into.
yes, and we're trying to build really a movement around that. So some of our advisors, one is an ex-DEA agent that actually used to arrest people for psychedelics. And then we
It's
have
cool.
a yeah, it's really cool. His story is amazing. We helped transform his life. He was very, very depressed, and
Mhm.
through ketamine treatments, he's a different man now.
Yeah.
And he's very public and open about sharing his story.
And the podcast that goes along with your website, does that specifically just go into different topics of mental health, or what are you kind of covering on that podcast?
The Myself Wellness podcast is all about health and wellness. Some of it is patients that we have treated with ketamine therapy and
Mm,
their transformations. Other people in the industry bringing health and wellness and alternative ways
mhm,
of dealing with different problems to us.
mhm,
And then some of it is just about consciousness.
mhm.
So
How do you, I'm curious, and if you can't answer, of course, let me know, but how do you define consciousness? Like, what is consciousness to you?
ooh, that's a good one.
Because, yeah,
Consciousness to me
yeah.
is it's just a different way, I feel like, of looking at things, not following the norm.
Mm.
Yeah, it's having a different outlook on all different aspects of our life and actually questioning the narrative that we're being told.
Do you think it's more of you as the individual being in control rather than just being in the subconscious and, the monotony of going through the motions all day, every day?
I think that what Dr. Ferber, our psychiatrist, always says is be aware of your breath. And when you're aware of your breath, you're aware that everything around you is usually okay. And in that moment, everything is okay. So I'm sorry, just being aware of everything that's going on and just taking that step back and
That
really just observing.
that re I'm going to reiterate to people what you just said there, like be aware of your breath. Even that is so much easier said than done for a lot of people. A lot of people just
Mhm.
cannot center themselves and I suppose that is the consciousness because they're not in control of themselves and their consciousness. So I think that is an awesome line to wrap this up on. Very wise. Did you have anything you would like to add? Any sort of advice for people who are apprehensive to try psychedelics, but also other practices they could start immediately that you've seen help others with their mental health?
Um, I when you say the word meditation, like we were talking about, it can be scary for people. But meditation doesn't have to be sitting cross-legged with your eyes closed.
Mhm,
Meditation can just be going for a walk.
mhm,
Meditation can be going fishing. Meditation can be going to the gym. It's something that you can do to just turn your mind off and not be so hyper-focused on those ruminating thoughts.
mhm,
And then if you are seeking out ketamine treatments, do your research. Not all ketamine clinics are built the same. Everybody at Myself Wellness has firsthand experience with the medicine, so we can
mhm,
really help and guide you through your treatments.
mhm,
You should look for some place that has integration or therapy, but also somebody that understands these altered states of consciousness and has that experience to go with it.
mhm.
I've heard a lot of horror stories about other treatment centers and not being able to properly integrate these type of experiences. So just do your research and really know the place that you're going to and the people that are going to help you on this journey.
There is a lot to be said for having a teacher or a practitioner who has walked that same path or they have the experience because you really can't put a price on real life experience. It's the same in the weight loss world. If you have someone that's always been naturally slim trying to advise you to lose weight, it's very different to having someone who has lost a lot of weight and them advising you. So experience is just like knowledge, somewhat priceless.
I agree. I
Well,
really
thank you
agree with that
so
statement.
much for your time. Where can people follow you guys? I have your websites, they're going in the description, but do you guys have social media as well?
We do. Our Instagram is my.self.wellness. There's a lot of really great informational videos on there, really great content coming out.
Mm.
And just ways, that can help you. We're putting out breathwork videos, all different types of things. So be sure to follow us and you can find a lot of alternative healing modalities on there.
Yeah, for sure. I'm sure the breathwork videos are awesome because at the very least, if we can recognize our breath, we can hopefully make a difference on our mental health.
Yeah.
Well, thank you so much for your time. This has been a pleasure and super insightful. And hopefully, Canada takes some more steps in the direction of psychedelics in a regulated way that we can start to avail of.
The
Thank
whole
you
world
for,
needs it. Thank you.
well, they do. Thank you for your time.